my beautiful patients, actually from Miami. You may remember her, we did a laser on her a few months ago, and like, her skin is gorgeous. I cannot even tell your age, but you would never be able to guess it because she looks about 25 years younger than that. So you see she's a little bit still healing with some redness, but everything's perfect. I don't see any sun damage. Do you? Almost nothing. The biggest concern she has is the folds around her mouth because she has some laxity. We just did threads, you guys. So you'll check that out in the videos. We did some PDO threads on the neck, InstaLift, lower face with Miracle. Now we're working with some Galderma fillers, you guys, to improve the overall look of her lower face. This is gonna be a mix of things. We're gonna be using Refine right now. This is actually one of my favorite fillers to just sort of airbrush is what I call it. We're gonna go through the superficial part of the skin, and we're just gonna place very small threads of the filler to kind of lift and fill out this marionette area, because this area where she has her sort of mouth corners and creases, this is what really bothers her, and the only real treatment for this is to improve it with tightening, which is what we did with the threads. Now we're gonna do a little bit with volumization to kind of contour this whole area, including the nasolabial fold. So you guys could see I'm kind of up here. This is a softer filler. I call this the honey filler because this really stretches. It has a type of expression technology that stretches when you smile, so the chance of any migration or a chance of any clumping or bumping isn't really going to happen with this type of filler. Plus it's going to last a really good amount of time, and you can massage that area really out, and you can see already, take a look at this one side, even with just one syringe, the harshness of this corner, this triangle, is now much more softened. Same for her folds. So we're going to come and do that now on the opposite side, and I'm using a cannula to do this, you guys, so that it limits any bruising and pain for her, especially with her flying in and flying out. I want her to be able to get home easily. But I'm excited for her to see this combination of threading to lift and using the specific type of fillers to kind of fill, again, this sort of triangle right here. Some people call this the bow tie. I'll show you in a second. I'll actually draw it out for you so you get an idea of what we call the bow tie. And I teach this in my Emer University trainings, you guys. Our trainings already at the end of the year are basically full. We have a waiting list. I'm probably going to add more people or more training. So if you want to be a part of it, emeruniversity.com or info@emeruniversity.com. Make sure you definitely reach out to us because there's going to be some great cases and great patients there as well, which we love. And so again, I'm using this in this entire sort of area to not only improve the marionette, but give support to the lower face. Okay, and again, right at that crease, we're using a filler that is softer, more moldable, but has the ability to hold its shape and survive, meaning it will last a good amount of time in this area. Because remember, what do you guys do in this area? You talk, you smile, you laugh. When you move around, when you express, fillers can dissolve. So you need a filler that's going to stay in that area when you have expression, which is why it's called that technology.
Someone who joined a little bit late wants to know which filler you're using.
So that was Refine. Remember, you can tell them, you know, so we're doing it.
It's Refine.
So this is the Refine. So you guys see already, like, that's significantly better. But again, I was going to show you, where is that pencil? So let me show you what I was talking about with training. So if you're a beginner, this area of the mouth is an often neglected area, and a lot of people don't know how to adequately treat this area. So if you take a look right here, what am I drawing? What is that?
Bow tie.
It's a bow tie. So this is the area that when I started treating 16 years ago, people said, this is ridiculous, because I would always treat the chin crease, and we call this the lower cutaneous lip. But that area recesses as we get older, and you need to fill it. So there's some doctors that come from the middle and go all the way around. Honestly, I don't find that it gives the best look that way. You can. What we just did is we treated from one insertion point down here, and we're gonna do another one from up here, and you guys will see a significant improvement in the look of her chin, the corners of her mouth, and then the support that she needs. When I press in like this, look, it's not as deep. It means we have some filling now. So we're gonna do a little bit on her fold. Go ahead and grab there. And then what's not to love about lips, we're obviously gonna do a little lip. So we're using the whole portfolio, you guys will see, because what am I doing right now? Hold on. I'm gonna switch actually. Oh no, this is fine. We'll use some more refine. Oh, I need that needle again. Her skin's really good from the laser. So we have some good collagen there. Okay, go ahead. So we want to go into this piriform and get a nice amount of lift there. Give her support. Okay, I'm gonna do the same thing on the opposite side. So far, so good. That's great. Okay, turn a little that way. There you go. Okay, ready? And so this is where the artistry of fillers come in, because everyone goes, 6 syringes, 4 syringes, they think it's a lot. But each syringe, remember, is like a pea size. It's very small. It's just how it interacts within the body. So you need to understand what each technology does within the fillers and where it's applicable. That's why we're going to use Kiss for her lips, which is a different filler. And then I'll go and do a little bit more, again, through this central area, just to give her, the lower lip, some eversion and support. Because again, go ahead and grab there. As we age, we lose a little bit of volume through this area. And so we can literally use a cannula all the way across the central part of the bow tie and just build that volume here. And again, you want to use a filler that supports movement, that really sticks to the tissue, and will blend smoothly. And that's refine, so take a look. Okay, so now the whole lower face is completed. We can actually do even a cannula approach with her lip, why not? Give her a little less downtime. So let's do that. So we're now gonna go to her lip, and we're gonna do a little contouring there. Now remember, improving the lip actually does a nice amount for the lower face, because the lip tends to elongate in upper and then lose volume as we get older. Okay, it's just gonna feel weird, okay? 1, 2, 3, there you go. So we're gonna use Kiss here, you guys. This is a little bit of a different texture. Still has the ability to volumize, but nice and smooth. We're just gonna do a little bit through here and give her a nice volume. And go really slow. I like to kind of watch this. Cannula makes it a little bit safer, a little less painful. For her upper lip, we'll do a little bit too, and then we'll decide do we shape or not. The one thing about Kiss that's really unique, you guys, is when you use it, it actually changes a little bit over the few days afterwards. So you may see it initially, but it's not kind of fully what it's gonna look like. It's gonna be even smoother. I find that girls really love Kiss. And I always know that it's my coordinators telling people to do Kiss because they all want it. It's true. Okay, so just like that, look, 1 insertion point, full lower lip done. Let's start on the upper now. She doesn't want to look overdone. We just want to improve the corners and give her a little shape. Open slightly your mouth, just a little bit. Open just a little.
Open a little bit, abre la poquito la boca.
Just a teeny bit. Yeah, there you go.
Perfecto.
Perfect. Okay. Okay, and reason I like this is there's a couple ways you can use the cannula for this.
Someone said she looks amazing. It's the Emer magic.
Thank you. Yeah, oh my God. She's gonna look so good, you guys.
Wow, that already looks
She's
really
gonna
good.
love it. She already has a nice shape. So it's kind of just adding that little bit. And you see what it did now to the upper right lip compared to the upper left? You see now it's averted, it's elevated. You see the distance between the top here? Look, it's about a 2 millimeter difference. So now we're gonna do that same thing over here. Okay, open slightly. There you go. Good. And this is just to show you that there's different ways to use fillers. Doing great. It's not painful, which is good. That's why I like the cannula sometimes. Sometimes you do need a little bit above, which is what we're doing here. Going a little bit to the border because it's going to help the wrinkles, the fine wrinkles as well. So you just have to be careful. You watch how you inject it so you don't get migration. But in general, you won't if you do it right. Okay, let me see. Great.
Wow.
Okay, so show her really quick before I do Sculptra, because the next part's gonna be pan facial Sculptra, you guys. Let's take a look. I wanna show you really
Let me
quick.
take the phone.
Just take a look.
Wow, amazing.
Hold on, let me clean you. Let me clean. Look at the corners.
Look. My God.
See? But I want you to show you, look 45. Go like, hold it right here. That's where you can really see it the most.
Wow.
So what do you think
Amazing.
now?
Amazing.
Much more smooth. What do you think of the lips? Show everybody.
Love it.
I do too.
Love it.
They look really good.
Love it.
And see, smile as big as you can. Looks very natural. Smile.
Very nice.
See, I know it's hard right now because you have numbing. But this, see the folds significantly improve. And look, you guys, that
Beautiful.
little bit through here helps the corner,
Yes.
helps this, helps overall. And the folds are better. And when we pinch here, this is the key. You don't see as much indentation. That's the goal. So she had a lot more volume loss than you thought. So the
Wow.
next part's going to be
Thank you
adding a
so
little
much.
Sculptra. So go ahead and take that back. So
Thank you.
Sculptra now we're gonna do all over. We wanna lift, So what we're gonna do is, this is gonna build collagen, it's gonna hold the brows up, it's gonna keep the jawline defined, it's gonna keep the folds improved, minimize the jowls. And we do this a couple times the first year, a couple times at least the first year. And then we go from there maybe every 6 months or so a little bit. So always a good amount into the temples, because this helps the brow, it helps the eyes as we get a little bit older. I'll do those. You guys watch. You watch her. I'll do that. You do that.
Wow.
And always a little bit to mid face. Again, it's not going to be much volumization, but it's going to be lifting. So our goal is to just give it that little bit that kind of comes upward. We always massage it upward. So you stay on that side, Melissa. Go massage.
The mouse is amazing. Wow.
I know.
I can't believe it.
Told ya.
Wow. A new one.
Beautiful mouth. Makes a big difference for people. So we're going all the way down to the deep end of the swimming pool. Remember, I tell people the temple is like a swimming pool. The superficial end here, the deep end here, we're going to need to hit it at different levels. Right now we're working on the deep end because that's going to give the full volumization. You could go in with a cannula and even go externally, go even further into the temple, into the posterior part of the temple, and really lift the upper face. So we're going to do that back here by doing the preauricular area. You get a lot of lifting on the lateral part of the face. So it's very important. We just did her threads to have a little bit of support, which is why I'm going to go a little deeper and just do a little bit into the folds here. And then I'm going to do a teeny bit into her actual fold here as well, deeper than I would do the filler. Okay, well, let's hold here now. Switch with me.
A new one. A new one.
Yeah, to be perfect. So again, giving support to the preauricular area as we get older, you guys. This area tends to lose volume. And right here in front of the ear especially, it's a telltale sign when someone's had a facelift, because often, and that's not her, but I'm just saying in general, we lose volume over here. And so you want to volumize this area and keep it lifted, and so that it blends everything and it holds the jawline in place, okay? So we're giving her that little support back there. And then again, the last part, I didn't do the cheek on that side, we'll do that in a second. But again, going deeper than we did the filler, because refine's more superficial, and giving a little bit to this marionette area, little bit to her fold, just a little, again, all to just build volume and over time tighten the area and lift it. And then also to our deep medial fat pads, coming laterally. Perfect. And we just massage. So now the Sculptra's in there. She's going to look a little swollen and volumized, but that's going to settle, and then everything's going to lift. So our goal now is to see how this looks in the next 6 to 8 weeks, because we would build then a little more Sculptra once or twice more in the year, and then that's it. And then we maintain. Now her skin looks incredible from the laser, but there is something called Sculptra Glow, and that Sculptra Glow is going to be because collagen production is going to start to happen all over, and her skin's going to look even better. It thickens the skin, it makes the collagen better. So if we continue lasers, which I want to do for her, microneedling, radiofrequency, and peels and lasers, the Sculptra is also going to help improve it. So pan her face, kind of show how she looks, and that's it. We've made a successful anti-aging regimen that addressed lower face volume and descent, as well as full facial collagen production and lips. Don't forget those. All right, keep looking forward. Let them see how beautiful you look.
She's beautiful.
I know.
Looks awesome.
That's it.
Thank you so much.
And then you're gonna feel like a little